Erica, I just want to confirm. Let's see here. Oh, it shows. Oh, here. Erica, can you just confirm that you can see this on your screen, please? Sorry.
Yeah. Yeah.
Okay.
I can see. Perfect.
Wait, is there a way to? Okay, so is there a way to minimize this? Just kind of click on the. Okay. All right, just hold on a second, Erica, because it looks like there's that the thing for the webinar. This one right here. Oh, it says hide. There it goes. Okay. Thank you. Thank you. Thank you. Okay. Oh, that's okay. 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 Thank you. Thank you. Okay. Thank you. Okay. Okay. So we are ready to begin. And I believe, Erica, you have this recorded. If there's anything that happens on your screen, if you could just please just let me know, just unmute yourself and let me know. And we're going to go ahead and get started. So thank you everybody for coming. I know that some of you have requested this and very appreciative of Fresno County to say, hey, we're going to be up there anyways. Could you stick around if we can make it happen? And I said, sure, I can stick around. So I've made this presentation here. I've also have spoken with Stephen from CDE because he worked extensively with us to make sure that for our pilot rate. So this is really just an overview of how Alameda County did the increase to our pilot rate. So as many of you know, there is no new state money for the pilots. You can use only funds from existing participating contractors can be used. Funds collected can only be used to increase the rates in which they came from. So CCTR to CCTR, Prop 98 to Prop 98, and we'll talk more in details about that as well. Funds collected to increase the rates are have been and maybe that will change at just one time at the beginning of the pilot, and that amount is subtracted from the contract's MRA for the full duration of the pilot. We'll talk a little bit more detail how that really looks. Yes.
And if everyone was talking, my understanding that the unused funds for our county will be calculated on the year. Or is it this year we're going to calculate it? Since the plans will go into effect probably no sooner than July 1st, what year are we talking about for the funds?
So it's a combination, really. I mean, go ahead, Sam. I'm sorry.
Lorita.
Yes.
If you can put the microphone close to the person speaking or repeat the question would be great.
Perfect. I'll do that. Okay.
That would be kind of your experience would be one of those years.
Okay.
If we see reduction in contract CDs that's less than the most recent year, which is not the most recent year, then we'll ask. It's not like that's a deal breaker, but we'll ask. We thought about this.
Okay.
So just to repeat the question, so it's recorded. The question came about, which year is really looked at when you're talking about the unearned funds for a particular agency. And it's like, yes, there is the baseline year, but perhaps, the current year that you're in, the year that you just finished off, really looking at that and working with CD as well to see which one would be the best year to look at, even like historically. And I'll talk a little bit more about that too, because our rates have increased, I think it would be maybe perhaps some agencies a little bit hard to see, well, what is their potential unearned funds right now? So just understanding the contract funding sources themselves. So I did provide some sample contracts that you can look at. So on the first page, has information of your MRA, your FSR, your CDEs, and your minimum days of operation. On the second page, especially when we're looking at non-LEA CSPP contracts, you have the separation between Prop 98 money and non-Prop 98 money. Then for CSPP, as I stated, the LEAs generally have just one contract page because they only have Prop 98 money. So here are the sample contracts that I provided to you. The breakdown of their MRA, their standard reimbursement rates, their CDEs, and their minimum days of operation. You have your LEA CCTRs, your non-LEA CCTRs. Sure. Point of clarification, hold on.
My understanding was that CCTR was federal funded, not Prop 98, and we have LEAs that operate CCTR. So this would not necessarily be applicable that all LEAs have Prop 98 funding. We have to carefully look at every contract.
So LEAs for their CSPP only have Prop 98 money. There's no Prop 98 money in CCTR for everybody.
How about the full day, full year CSPP operated by?
So the full day, full year, I'm going to talk about that. There's a slide that talks about why LEAs are operating full year, full day with Prop 98 money. So we'll get to that. So understanding here, you're looking at your LEA CCTR contract and your non-LEA CCTR contract. As you can see, the funding source is the same. So therefore, for when it comes to your CCTR contracts, there's no need to separate the funding source. So LEAs and non-LEAs are under the same category as CCTR. You're not separating out their funding between funding sources. Now, when we look at their CSPP contract, here we have our LEA CSPP contractor. Their funding is only Prop 98. And then you have your non-LEA CSPP contractors that has a combination of Prop 98 and non-Prop 98 money. Therefore, when you are collecting money to be put into a pot, that money does need to be separated out between Prop 98 and non-Prop 98 funds. So understanding a little bit about Prop 98 funding. LEA contractors, as you can see here, you got the community colleges, you got your LEAs, you got your charters. They have Prop 98 funding, and that Prop 98 funding is to operate full day, full year, and part day, part year sessions. So they are authorized to use Prop 98 money in order to support a full day, full year program. Non-LEAs are not. Therefore, they have a combination between Prop 98 money and non-Prop 98 money. On average, non-LEAs have about 54% of their MRA is funded through Prop 98, and 46% of it is funded through non-Prop 98 funds. Also to note, because I was actually a contractor of one of these programs, if you have a contractor that is only operating a part day, part year session, they could potentially have only Prop 98 money and not be an LEA. Just so you know, because that was me when I was a contractor. So when you're looking at the contract information itself, I found it to be very useful to think of it and you're starting to collect this money is really looking at your contract having three phases. So you have your original, and that's what the agency currently has. Then you have your what I call the pre-pilot. So this is what the agency's MRA and CDE is after any contributions they may have made into a pot, but before the pilot rate increase. And then you have your pilot, which now is your new pilot MRA, standard reimbursement rate, your CDEs, and the minimum days of operation. after contributions have been made and distributed to increase the reimbursement rate. So let's take a look at the CCTR contracts. I hope this print isn't too fine, but you have your papers in front of you as well to take a look. So you have your LEA CCTRs. Again, because the CCTRs, it's all the same funding, we didn't have to separate out. So you have your original here. This particular contractor has $429,605 for their MRA. They have decided to contribute $50,000 into the pot. So $50,000 is now subtracted from their original MRA, as is 1,031 CDEs from their original CDE, because you think that the 1,030 CDEs is equivalent to the $50,000. Okay, and that's just done by dividing the money. So now their new pre-pilot information is their MRA is $379,605, and their pre-pilot CDEs is $7,825. You look at number 2 or number 1 for the non-LEA. They have $2.9 million for their original MRA, $59,790 for their original CDEs. They have contributed $250,000 to the pot. That again is, so that $250,000 is subtracted from their MRA, as is the 5,155 CDEs. So now their pre-pilot MRA is $2,650,413, and their pre-pilot CDE is $54,635. Your next non-LEA CCT contractor, they have their original at $412,917. They have decided not to contribute into the pot. Therefore, their pre-pilot MRA and CDE are the same as their original. Now we're looking at determining the pilot reimbursement increase itself. So after all the participating contractors who have chosen to have contributed to the pot dollars are divided by the total pre-pilot CDEs from all participating CCTR contractors, regardless if they've contributed into the pot or not. Okay. So if we're looking at, let's say your county only had 3 contractors, which sounds like some of you might, like for CCTR, there's only like 2 or 3. This is what it would look like. So here is the total pot money. So that was that $50,000 from the LEA, the $250,000 from the other one, so $300,000 of their pot money. Then you have your pre-pilot CDEs, which that is from all 3 agencies, which comes out to $76,127. You divide that, and now you get your pilot reimbursement rate increase at $3.94. Okay. Now it's time to calculate the actual pilot reimbursement rate. So you start off with your original reimbursement rate. This case, we made it very easy. Everybody has the same reimbursement rate of $48.51. In Alameda County, when we did it, ours did not, so it was a lot trickier. But so we could always talk in more details about that later. But right now, you're looking at everybody has the same reimbursement rate. You're adding that $3.94. So now the new pilot reimbursement rate is $52.45. So that is your new pilot reimbursement rate. The next step is really calculating each individual contract pilot MRA. So this is the first step, okay? The first step is you have to look at each agency's pre-pilot CDEs. So you had your LEAs, the 7,825, your other 2 non-LEAs, and you multiply that by the rate increase, the $3.94. And then that will give you the total dollar amount to be added to your pre-pilot MRA. So for the LEAs, you have the $30,831 will be added to their pre-pilot MRA. The number one non-LEA is $215,000 and change, and the non-LEA number two is $33,537. So this is now the step 2 and final step of actually calculating the individual contract pilot MRA. So you took your dollar amount that you calculated on the first step, $30,000. You add that to each agency's pre-pilot MRA. Now that brings you to your final pilot MRA. So now your LEA has a new pilot MRA of $410,436. Your non-LEA number one CCTR contractors $2,865,675, and your non-LEA number two has $446,454. Here is your final CCTR contracts, and I put under in parentheses what the original was. As you can see, your days of operation stay the same. That does not get changed with the pilot. So this is what the original, where they started off, and this is their final pilot MRA and reimbursement rate and CDEs, which again, the final approval is of course by CDE. Any questions or anything up to now, or any additional comments? Yes, okay, another question. Okay.
So as you were going through this process, the people that come to the table from the contractors, they get it. I'm gonna serve more kids, I'm gonna get more money per child. Great. They have to take it to their signatories, school boards, boards of directors, so on and so forth. What other technical assistance, or how were they able to explain and convey that? Because all they're going to see in their contract is a reduction of dollars at the bottom line.
Well, I know for Alameda, a lot had to do with, well, you're already not earning that amount. You're turning that money back already. So that money will now will be able to use to give you a higher reimbursement rate. So although you have money to serve 200 children, you're only really serving 100 children. Why not take that extra money for that 100 children that you're not serving, turn it into a rate increase? That way then you get reimbursed to serve those 100 children at a higher rate.
So then, as we're moving forward, we should be advising the contractors, start getting your ducks in a row and pull up your earning history and your CDE history, so that when you take it to your board, you can present this as a benefit and they can sign it.
Right, we want to focus on the earned dollars that they have, not the contractual dollars.
Yeah. So yeah, you really want to look at, the earned dollars and not what their contract dollars were. Oh, yes, Michael.
Yeah, our county's experience last year, we had our providers engaged early when the bill was written. So, fortunately the bill was passed last September, and the next few months we were involved with Peggy and her team, brought Peggy to our Title V provider meetings. It's something we mentioned at the last meeting. It would be important to continue working with your Title V providers group if you've seen one in your county. Get the formula in front of them, and that would answer any questions sort of on the front end, and then move forward with pilot participation agreements around this time last year. Those questions were really answered ahead of time. Folks are ready to go and give up the dollars to.
And
we'll continue to work. Thanks to Peggy and Stephen and his team still working to regulate some of the things. When the rubber hit the road, in terms of reality, we've experienced contractors turning funds back. Late in April and early April and late a few months ago, so we're still continuing to determine the value rate.
Yeah, and then in the presentation, I do have at the end, I have some recommendations to look at as well when you're looking at contractors and what kind of contribution they could realistically make to increase the reimbursement rate. So now we're looking at CSPP. So the same process is followed when you're looking at the CSPP contract as far as calculating the new pilot contract information. However, additional steps do need to be taken to separate the Prop 98 and the non-Prop 98 money. So at this stage, you really need to think about for CSPP, you have two pots of contribution. Again, Prop 98, non-Prop 98. When an LEA or a part day, part year CSPP program that perhaps only has Prop 98 money, 100% of any contribution they make into the pot goes into the Prop 98 pot. While a non-LEA, when they make a contribution to the pot, approximately 54% of that will go into the Prop 98 pot, and the remaining will go into the non-Prop 98 pot. We're going to look at each contract. So here is an LEA CSPP contract. Here's their original. 100% of their MRA is Prop 98, as is, again, 100% of their CDEs is funded by Prop 98. This contractor has contributed $450,000 to the pot. So 100% of that contribution now goes into the Prop 98 pot. And below is their pre-pilot MRA and CDE now. Now we're looking at a non-LEA CSPP contractor. Their original MRA is $297,055. 54% of that, or $160,575 of their MRA is Prop 98. And again, that information is found on page 2 of their contract. And 46% of that MRA is Prop 98. And the CDEs are also separated in that same fashion. This contractor has decided to contribute $20,000 to the pot. So $10,800 goes into the Prop 98 pot, while $9,200 goes into the Prop 98 pot. And again, that's 54%, 46%. So you're looking at your pre-pilot MRA. You just subtract out that $20,000. So the pre-pilot MRA is $277,055. Your pre-pilot CDEs is $5,643. But again, you need to look at those CDs separately as well because the money is separate. Therefore, the CDEs are separate. So you have 3,074 of those CDEs as Prop 98 and 2,596 CDEs as non-Prop 98. The same fashion. Yes, a question. Okay.
So did you receive a list from CPE of who opted, or did you have to collect all the contracts from each individual contractor?
Yeah. Great. That's a great question. So did CDE provide us the contracts, or did we have to individually? A combination of both. So because in Alameda County, we were already providing fiscal support to contractors, we were able to get contractors to send us their contracts directly. But whenever after an agency had signed a participation agreement, we would send it over to CDE and then they would send us their contract. And we just wanted to make sure, because sometimes some contractors, they didn't have Amendment 1 or something to that effect. You know, they had another one and they forgot all about amendment. So it was good to then get them directly from CDE. There's also, I think at that time, maybe some contractors might have made a change and put them, like especially the LEAs, that was the last time that they were able to move their money from CSPP to CCTR. So we wanted to make sure that we definitely had that correct information. So it was a combination of both. After they signed, CDE provided this contract information. Yeah.
We received all of the Prop 98 written breakdown or not.
Okay.
Is it a fair assumption that CD will continue that practice?
Yes, so there's two sets of data that we provide. One of which is the funding data, this data here. We'll provide at the contractor level. We can do that before we have the agreement. The earnings piece, though, is something we will wait. We can provide that in aggregate, but not by contract until we have, the agreement of
Okay. Okay. So, so here is our second non-LEA. So in this particular circumstance, they actually had only 47% of their MRA as Prop 98 money, and 53% of their MRA was non-Prop 98 money. So a little bit different from what typical, but that's where the money fell, and that's how it was calculated. This contractor decided to contribute $375,000 into a pot. So again, following that same breakdown, 47% of that went into the Prop 98 money pot, and 53% of that contribution went into the non-Prop 98 pot. And here's your pre-pilot, $1,269,359, and the pre-pilot CDEs, $25,853. Again, with a breakdown between the Prop 98 and non-Prop 98 CDEs. So now you have your pot of money. So you have your Prop 98 fund and your non-Prop 98. Following the same process as we did with the CCTR, we took that pot of money, we divided it by the pre-pilot CDEs, and that was the reasoning behind having to separate out those CDEs between Prop 98 and non-Prop 98 CDEs. And we come to a reimbursement rate for Prop 98 at $9.52, and the non-Prop 98 reimbursement rate of $12.76. So therefore, in this example, reimbursement rate increases can be calculated separately between a CSPP full day rate and a part day rate, since the Prop 98 funds are for funding part day sessions. So if you were to follow this model, here your original reimbursement rates for full day was $49.10, while your part day using the 0.6193 factor is $30.41. You would add the $12.76 to your full day, because that was your non-Prop 98 rate increases, and the $9.52 for your part day rate, because that was what you concluded from your Prop 98 money. Therefore, then on your pilot reimbursement rate for your full day would come to $61.86, while your part day would be $39.93. I know that this is the case for San Francisco County, that they have a different factor, because their part day CSPP is at a higher rate. I think it's like 0.69 something or another, while the state is 0.6193. That was because of, way back when they did those calculations, they increased their part day rate. Okay.
Calculations, the rate preceded the Prop 98, when CDB dealt with the Prop 98, but we managed it to.
It was, pre-2009, and where we had 5 different preschool contracts. So this is the part day preschool, there was a lot more, funds that. So when we converted to one contract, the part day duration was already higher. So yeah.
So if the Prop 98 money is larger than the non-Prop 98 pot, as it was in Alameda County, what we were able to do is we were able to work with CDE directly to adjust the percentage of the contribution from the non-LEA contractors, so that a higher percentage of their contribution actually came from the non-Prop 98 funds. and therefore having equal amounts in each pot in order just to raise the full rate reimbursement only. That's what we were able to do during, with some just keep on calculating out and working again with CDE with their approval. Like we did our calculations, CDE reviewed it, looking at, what is the Prop 98 versus non-Prop 98 percentage, and working with us in that manner. This worked out really good for us because we actually had a target rate that we minimally wanted to reach. So many ways we kind of like worked a little bit, backwards. So what we did is after some preliminary contributions, we calculated like how much more we needed in order to reach our pilot reimbursement rate that we wanted, and then work backwards from there. So we started with the amount that we needed in each pot and worked to reach out to contractors to contribute like specific amounts that would really help us get to our target reimbursement rate that we wanted. So here are your next steps and recommendations among so much more. Of course, understanding we have been very fortunate to receive an increase to our rates in July, and it may be very difficult for our agencies right now to really know the full impact about their earnings for this fiscal year. What I would recommend is really reviewing their projections. So if they themselves internally are not doing it, minimally they're looking at their projection reports that they're receiving from their fiscal analyst, seeing how that looks, but then also looking at their actual enrollment numbers as well. Because as you know, especially for those that are operating all year, CCTR school age is probably the trickiest, because during the summertime, they come full time, right? And then during the school year, it's just about, 60 days of that is really full. When you're really looking at they're operating 240 days, only 180 days of that is they're only there for, part-time. So sometimes when you get your first quarter projections for CCTR, when you're operating like only a school age, it looks really high. That's because you had so many children during the summer at full time, but knowing that that's going to decrease. So I, again, highly encourage really looking at actual enrollment numbers and doing projections out that way. The other thing that I would recommend looking and reviewing is the actual certified family fees that you've collected in the past, as well as looking at any what your projection of family fees will be for this fiscal year, and consider contributing that dollar amount to the under earnings, to the pot. Again, because as you know, your family fees are subtracted from your MRAs. So looking at it that way, that, sometimes there's an agency that they are doing great. They have the enrollment, the children are there, but they're still under earning. And many times they're under earning their family fees. So as an agency, they're still whole, but that dollar amount is subtracted from their MRA. So from somebody on the outside looking like, oh, they're still turning back that $20,000 to the state, but that $20,000 was really the family fees that they had collected. Okay, so here's the point for questions and answers. Is there anything else? Yeah. Yes.
Differences between the way Lorita has approached it and what we've done with Clara.
Yeah, right here. I'll bring it to you. Here you go.
Okay. So the underlying math is the same, essentially. We get to it a little bit differently. And so the spreadsheet that I was mentioning that we've built, the first thing is in terms of the contributions to the pot. Now you saw the translation that Lorita did. These are exactly equivalent, but we discussed it in terms of child days enrollment. So rather than in terms of dollars, it's child days of enrollment. And what we actually focused on was not how many child days of enrollment are you going to contribute, but what is your target child days of enrollment? So what do you think is a realistic number of child days of enrollment to hit? And we try to make sure that that is, there's a buffer in that, right? So you know, they think they can do 15,000 child days of enrollment, maybe you assume 17,000 or something like that. That is exactly the equivalent to contributing whatever the difference is in the contract, and the dollars equal to that. The other piece is we do very actively look at the family fees. So if you say, I'm going to hit 7,500 child days of enrollment, and my contract is for 7,500, well, in fact, we know it doesn't take that much, it doesn't take the full contract to earn that because of the family fees. So we've accounted for that. We had some of the rounds that we've done this year with Stephen and his team have been trying to deal with, we don't know what the family fees are going to be now, right, because the new schedule. So this is something that's going to be a little bit tricky. But basically what we take as the input is Stephen's data that has this split already by the Prop 98 or not. And then we take that target child days of enrollment. And then if we've got everything, once we get it cleaned up so that it is understandable to people other than me, Stephen, and his analyst, Joe, basically, once you put those in, you'll be able to run everything else off of it. So you won't have to do the separate negotiation of the Prop 98 or not. What comes out is sort of equivalent, again, to what Lorita just showed, which is a different part day rate, but in this case, it's in the adjustment factor. So we basically calculate an adjustment factor as well as a rate. The math is exactly the same. The sort of path to get it at it is a little bit different. But just, you know, if we build that and people end up using it, I just want to sort of set expectations for that.
Yeah, definitely. I have a question on family fees then. Yeah. Because you and I talked and you brought it up again. If an agency is fully earning their contract and their family fees on a consistent basis, what do they contribute?
They don't, but they still split, right? Because you have to hit the goal, you have to hit that baseline and more, right? You need them to keep earning. So they're not going to change their enrollment, they're not going to change their contribution. What I actually do is I take all of these estimated, so
what you saw from Lorita is she took the pot of contributions and divided it by the remaining child days of enrollment. But what I've done is take the full pot, so the family fees and the MRA, and divided by this target to get to a number, and then sort of backed out to the rate from that. In this most recent version, we just put in a guess factor for how much we thought the family fees would fall. And for people who were fully earning with family fees, we are assuming that those family fees are going to fall. So to keep earning the same, you'd actually need more. So we ended up in Santa Clara doing kind of a complicated final calculation where we gave extra money, not to those contractors who weren't contributing. We gave an extra money to contractors who were contributing. So we basically kept money in the system to cover the contractors who may lose family fees and may therefore need more MRA in the end. But rather than give it to them up front, we kept it for essentially temporary transfers. So if I'm a contractor giving up, so say I'm going to give up a pot of 200,000, I've offered to give up 200,000. We may actually only reduce their contract by $175,000 because we're keeping $25,000 in that somebody else may need. But we want that contractor who's giving it up to have the first client, and so that's why we put it there. So there's a lot of complicated rounds that you can do with this over time. But that's basically a last round strategy that we did so that even in the face of lower estimated family fees, we felt that we had enough money in the system. If you have now from current experience a good estimate of the family fees, you wouldn't have to do that piece. It was just because
you'd want to use your current.
You'd want to use your current, exactly. And we only had the past data at the time that we were doing this.
So one of the questions that might be here has been related to the contribution, because I've already talked to one agency that's got a pretty consistent pattern. And there's at least 2 or 3 in our county of earning both. Can they contribute from their state reserve? No, it would have to be their unrestricted money if they chose to contribute.
It would have to be from under
Yeah, unrestricted.
No, actually, so just to clarify, I mean, unless things have changed, so we actually had a contractor who was not under earning, but still contributed into the pot, because how it broke it down when I was telling you about our target rate and we needed an extra little money, right? And all those that were under earning, they've kind of like tapped out. They're like, no, I really can't give any more. We went to a contractor who had a significant amount and actually had a significant amount of family fees as well. But even though they were still earning their family fees, right? We were able to go to them, and it was not even $4,000. That we need $4,000 to get the pot to this level in order for our reimbursement rate to be this. And for this particular instance, it's not. And actually, I'll pass this around. This is Alameda's spreadsheet itself. With that contribution, they themselves were able to receive an additional $60,000 into their MRA. Again, this is not typical, but you can see as I pass this around, and I could like send it electronically as well, you know, and there's no names, and it's all anonymous here. So you can see, you know, agencies that have contributed, and I have a difference of like, okay, this is what they contributed, this is what their MRA increase went up to, this is where their CDEs went up to, the differences. So that's, but yeah, no, they cannot contribute from the reserve. That I already knew for sure.
Based on family fees, this agency?
Right. Yes. Yes. Well, actually, for us, it was a specific dollar amount, and that was just because of the spreadsheet that I had created. I was working with dollars and not CDEs. I mean, even though they intermingle, right? But I was like, oh my goodness, I needed $3,048 more to get the pot to this amount, which would then allow us to have the reimbursement rate to be, yeah.
This is another complicated communication issue. So,
and part of the reason why we went to talking about the contribution of CDEs, and even in the letters that we had contractors when they agreed to this, we had them, the letters said, I'm contributing this many child days enrollment, not this many dollars, because so you contribute $200,000, say, but your contract doesn't go down by that because you get a higher rate. So it's confusing to think about it as a cut. It's not a cut in your contract of $200,000, and that's why it's a little. I find it easier to talk about contributing child days enrollment.
Any other questions or answers or any additional comments? Steven, do you want to add anything else? Yeah. Yeah. Okay.
I hit a roadblock here on this slide where we're adding the full day. It's page 10. The second slide on page 10.
It's the one where the Prop 98 and non-Prop 98 pot of money that then gets into, you know, your full day SSR, your original, and your part day.
And so it may just work out, and I'm not able to kind of make the connection. But when I looked at the full day rate, we've got a full day adjustment for CSPP of, you know, 1276 and the part day of 952. This seems like this is for non-LEAs, and I don't really see LEA the LEA situation represented here, because if I look at, you know, the part day, which is the Prop 98 part from the slide before, the $9.52, that the LEAs are entirely Prop 98. So their full day rate, would that then also go up by $9.52? And then if so, are we going to be at a different reimbursement rate for LEAs and non-LEAs? So we'd be going from 4910, adding 1276 for non-LEAs, 4910, adding 952 for LEAs.
So I remember, because that came up for Alameda County, and I remember you came and said, well, this is what we can do, and I said no. And so that's why then I went back and I said, okay, we need to get more money to increase it. So, but again, so I think it all works out. And I didn't want to go into more details about it because I said we just worked with CDE, because getting into the nitty gritty of it all. Yes, I mean, it was intense, but I think, having everyone understand that the money does need to be separated, and then when we're getting into the nitty gritty of it all, to really working closely, with Stephen and saying, okay, this is, like I had my idea in my brain how it calculated numbers. Stephen, obviously, because, knowing that the Prop 98 money does increase the LEAs, which that's where the proposal you had thrown back to us. And we said, no, we don't want that, because our LEAs actually were at a higher reimbursement rate already. We're like, oh my God, this is going to make it even more, disproportionate for our county. So then that's why then we, with your help, we were able to figure it out. It's like, okay, let's just say that we had those that have both non-Prop 98 and Prop 98 money make their non-Prop 98 contribution be at a higher percentage, so that it would be all even. So we just raised the single full day reimbursement rate.
I think that works out best. I think the other thing too, I'd say is kind of to be like consistent with what you have in here, the percentage breakdown of money that's coming out of the Prop 98 pot versus the non-Prop 98 pot, that whatever goes back into the contract has to maintain that same proportion.
Right. Exactly. Okay. Oh, you lost your thought. Okay. All right. Okay. Another question?
Mine was just logistics for information. So clearly, we're going to learn from all of your experience and try to, and as much as possible, just go to CDE to get the information for like the reports. Because if you're going to look for 3 of our contractors, you've got them on spreadsheets, you might as well just give us the whole thing. So my initial thought was to have the participation also include the release. I still fail to understand why contract earnings by a contractor are private affairs that would need to be signed off by their signatory. Because to me, it's a public contract through a public venue, and the earnings should be public documents. And I know it's a detail, but when we're looking, like for our county, the majority are school districts, the majority of the contractors. And so to get into school board or to get the signatory to sign off on a release to give the county office of ed or the LPC just the information as something in and of itself, it's going to get dropped everywhere. It's not going to happen. And if I go to the contractors that, we meet with on a regular basis, the ones that operate the program, and I say, okay, bring your quarterly report. Which one is that? What does it look like? What's the number of the form? Or, do your annual report. So I'm not sure how to move forward logistically to be able to get to where I'm having a contractor meeting and I have a folder for each contractor with their contract information, the prior year final earnings report, final CDE allocation report, and maybe the most recent quarterly, without having to go through that whole release piece with the contractors, because to me, none of that is FERPA or HIPAA protected information. So I'm failing to understand why we have to have it.
It's a sensitivity. We are being responsive to the sensitivity of agencies when we release this data to LPCs before. We got a lot of pushback from contractors. They didn't like that we were sharing. And this is in the context of VTT, right? And there was this, right? And so it was, we were potentially giving LPCs information that they could use as leverage to encourage transfers amongst contractors. Now, it's not to say that we have to follow this the same, we have to treat this release of information the same way, because really it is for a different purpose. So while we've said that this participation agreement, that this is how we want to handle it, I don't think that's final. And so I think that there should be a less cumbersome way. We could probably find a less cumbersome way of getting that, I don't know, confirmation, acknowledgement, whatever it is from the contractor to release the information.
So even if you were to come out with guidance that, like in our case, our field services consultant is Sandy Padetucci for the whole county. Thank goodness we have one name. So if whoever the director, the operating director for the program is, not the signatory, can sign off, that would be a huge relief. Because I mean, if I give that to some of my directors at an LEA, the official signature belongs to the superintendent. Unless it's otherwise specified, it will go to the superintendent. It will go to the president of a board of a nonprofit, because that is the default for anything related to the contract. So, I mean, it doesn't have to be like all or nothing, but if there's an in-between, if you could just specify what it is, then it'll make life easier for us. Thanks.
I don't see why a contract director couldn't.
That would be a big
You
thing.
know, yeah.
Okay, so it's, okay.
For receipt of the report.
Not for signing the amendment. Okay, yeah.
So it sounds like that, you know, CDE will consider looking into allowing the program director to be able to sign something stating that, yes, you may release my contract pages and perhaps the fourth quarter, you know, report, and maybe even one of the projection reports from this year's first quarter. So that's something that Stephen will take back and get back to everybody on. Okay, hold on one second. Sorry, say that again.
Asking for clarification. So when it rises to the level of school district or board approval, it would lie with the program director person. Okay.
Yeah, so whoever's the contact name for it, yeah, the contract. But again, and that doesn't mean that this will just be a release of this particular information, nothing more to really look at, and working with the directors themselves of these programs to, you know, so that you can work with them in looking at their under earnings and perhaps saying like, well, perhaps we should suggest contributing, you know, $200,000 into a pot because we're projecting this under earning, and you always have under earned this amount. So, okay. Yeah.
Just a confirmation question. So what if we're not asking for the level of detail of the contracts and the last quarterly report, but really just contractor and contract type and the unearned over the court, maybe over the past 3 years? Is that what we still need to have permission? Okay.
If it's at the contractor's level, then yes, they would still need to sign something to release that information. Because from my understanding, from our meeting beforehand, if you're looking at just for your county and it says that, oh, here it is, the county, your CSPP under earnings was this amount, and doesn't specify the agencies, that's something that would be available. However, when you want to have more specific details per agency at an agency level, then you would require some sort of signing off agreeing to that.
But you're saying a certificate of participation, not the MOU, or are you using those interchangeably in your?
I'm thinking of that interchangeably.
Because the MOU will be the last thing the agency signs, that happens to be at the top level usually.
So in Alameda County, so the difference is like, okay, participation versus the MOU, right? So and it may be different now, but I think in Alameda County, we had agencies kind of give like a verbal or even sent an email off to our fiscal analyst saying, yes, we are going to be participating, without the actual physical paper at that time, because knowing that paper then may have to go to somebody else to sign, to just release that particular information. The other recommendation that has come up for us was the word MOU, because for certain agencies, the MOU prompted legal department to get involved. So, and I just want to say thank you to Stephen because he has to attend other meetings. So thank you so much, Stephen, for attending and everything. We greatly appreciate it. So that's something to consider because we originally had it as MOU and it went out to this one particular agency and she told us, she said, legal department has to get involved when it's a MOU. But if you call it a participation agreement, legal department doesn't have to view it. And it can still go to obviously the proper channels. Like the person who signs that participation agreement has to be the person who signs the physical contract. Yeah. Okay. So, so that was, why we called it a participation agreement instead of an MOU.
Okay. We can call it, I'm just saying anything that says agreement also triggers because it's interagency agreements. Right? They all trigger. But if it's intent to participate, kind of like letters of intent with the official signatory. So then what I'm hearing is to just rev up the conversations and to be able to have information for us to just develop our pilot. We just need the contact for the contract to be able to sign the release so that we can have the appropriate reports to have the discussion. Once we've developed our pilot draft and we're ready to start moving it through, then we get the intent to participate from the signatories that when collected, sent to CDE, trigger contracting processes that also go to the same signatories that signed the intent, correct?
So what I had understood from Stephen that it looks like that they would be considering where it's just the person who is perhaps the program director, for the agency to sign or send even an email saying, yes, it is our intention to participate, which would allow then for them to release this information to start the conversation. But then, yes, then but then in that same process though, and in that same time frame, you are still needing to, I would recommend, because it takes quite a bit of time, you are then still making appointments to meet with the person who is the one who has to have the final signature on it, and making that time to be on the agenda for the school board or the board of trustees to attend that meeting to present this in order to participate. So it's all at the same time, really. It's more of that, it sounds like they will get back to all of you whether or not just the director of the program can sign something to release that information to you initially, just to begin the process. That's from my understanding of it. Okay, so
two rounds of letters. The first was essentially an intent to participate, and that is where I would put also the authorization to release data, and I think it would be fine for it not to be an authorized signatory. When we got through the calculations and we had contracts that we knew were going to be reduced, CDE required then a letter of agreement to that reduction. And those typically were from the authorized signatory. And they required that in Santa Clara, and this is where we're trying to detach this. But in Santa Clara, they required that before they would approve the rate. They required those signed letters. But we only needed them for the contracts that were getting reduced. So even though all the other contracts were getting changed, we didn't need at that stage a signature because it was basically beneficial and there was assumed that there wasn't going to be an issue otherwise. So if your rate was being reduced, you had to agree to it, but you didn't have to agree to just get more money.
But it sounds to me like.
Okay, so there's another question. Hold on. No.
Oh, me.
I just wanted to make sure I
Okay,
bring the phone.
so what I'm trying to clarify based on what you just said about which the chicken or the egg, I think I feel for us, we've got to get something signed by somebody or sent to CDE so we can get the contract information, because we have one big person in the county who's turning back almost all the money, and all the little people aren't. They're not going to make any pot. to speak of. So we need to know who it is. We're not quite sure which one of the two big ones is turning back the money. But I'm thinking I think I'd be inclined to say, let's do something like at least the program director signs off. We have an intent to participate and we want this information released, knowing that the whole agreement, MOU, whatever we call it, that is going to take longer to get that done. For one, you have to have what you're going to do. You have to have your plan to some degree for those people to know what it entails. This would just say, we're letting you give them that information.
Hold on one sec, hold on. You need to have all the information and the people around the table from the beginning, right? So if somebody, say we do a release of information, for lack of a better word right now, release of information just to get the process started. A few of the contractors in the county don't sign. We don't have their information at the table. Then is that something that they're not in? So to at least have, that's why I like that idea of putting that together with a letter of intent signed by the program director. If Stephen says that's good enough, that way we at least have something both ways, either agreement or disagreement on that form, so that they can't come back to us later and say, oh, you never told us that, we never signed, that wasn't the, so I need to, maybe my legal brain is just too much in me, from experience, but we need to have something from CDE saying it's okay for us as LPCs to contact the contract director if it's different from the signatory, right? Depending on the agency, and then their decision would be whether we move forward or not move forward and keep insisting with that contractor. I mean, of course, if we get 2 or 3, then I would probably go like the next level up and just confirm. But at least if they say no, but to have a yes or a no and have them be the first contact and have that stick. Okay, there's some.
So if I can just share, how, besides the fact we started planning early, how fast we moved it through our LEAs is almost every county, I believe, it's situated this way, at least the ones that I've worked in, have a superintendent's meeting where their superintendents meet with their county superintendent, and we got time on that agenda is what we did. And so we went and we basically did the presentation, and it wasn't that they signed then, it's that we made all the superintendents aware of what the pilot was. And we did a very simple, informal presentation. We did give them a copy of the MOU, the participation agreement, so they knew what it was. And I was able to answer any questions that they had about the participation of it, so they were aware. And then they just put them, more than half of them went on consent agendas because there was no fiscal impact based on the participation agreement. And we also, when we did that, we also included, for the ones that I didn't go and actually present at their meetings for them that they asked, I actually put on there, we gave them a sample board briefer that says that, so they could put on the consent agenda, this is the board briefer, this is what it says, here's the fiscal impact, and and they also attached it to how it affected their LCAP funding or whatever standards they were trying to meet by participating in this particular thing. And that, I think, moved them through the LEAs much faster. I would say 75% of them went to consent agenda item because of that, and the other 25 actually came to their meeting, and even though it was on consent agenda, they still had me there to present a little, 5-minute answer question thing.
Okay, here's the follow-up.
Oh, I was just asking if you could share some of the documents that you met, the board brief.
All the other counties. The board briefers are one of my people that's on there, because we've been meeting as a county, as a contractor county for years. So we started this plan early, and that's why, I feel for you guys that are early. I'm like sitting there going, I just said, send me your damn contract, and they sent it to me, each of the agencies. So for, getting that, then when he said that, oh, well, we'll give you all that, I'm like, really? I didn't have to sit here and wait for and print all these emails that were coming in. But yeah, it was just, she's the department for the Child and Family Resource Center for one of our school districts. So she wrote it knowing that this is what she would have written for it, and then shared it. We sent it out to all the LEAs with the MOU so they could cut and paste it onto theirs. and it made it much easier. But I would suggest that if you want to make it easier to start, instead of trying to starting here and working your way up, like starting with your program director, find out if your county level has a county superintendent meeting where they usually meet with their superintendent of the county, and see if you can get on their board from the get-go, even if you don't have them, but just letting them know this is coming down the pipe. One of these very simple, I mean, there's versions online that I've seen that are like 7, 8 slides that say, this is what the pilot program is. It's going to be rolling out, to all of the different LEAs. You guys have a program, blah, blah, these are the benefits to you. And that made it much more easier, I think, for many agencies in our county to push it through, because we started here instead of here. So, just an idea.
Monterey. That was Monterey County. Any other questions or comments? No? Okay. We will go ahead and conclude this. So I just wanted to say thank you so much. Obviously, you all have my contact information. We all have each other's contact information. So please share with each other experiences that you've gone through already, so that we're not all reinventing the wheel again. Thank you.